Welcome to this guide on documenting respiratory failure. It is a high-value diagnosis that is often underdocumented. To ensure accuracy, follow a simple formula. Every time you document respiratory failure, it should consist of three specific parts: the acuity, the type, and the phrase respiratory failure. The formula is straightforward. First, identify the acuity. How urgent is the condition? Second, define the type. Which gas is the issue? Hypoxemic or hypercapnic? Finally, use the exact term, respiratory failure. Combining these three elements, acuity, type, and the term itself, ensures your documentation is complete and codable. Let's break down the first part. Acuity. There are four standard options. Use acute for a new, sudden onset. Choose acute on chronic when there is an acute worsening on a chronic baseline. Select exacerbation for a flare of existing disease, or chronic if the condition is long-standing and stable. Next is the type, which identifies the gas causing the problem. Hypoxemic respiratory failure means the lungs cannot get enough oxygen into the blood. Hypercapnic respiratory failure means the lungs cannot clear enough carbon dioxide. Some patients may experience both, but you should always document at least one. When you put it all together, you create a clear, complete diagnosis. For example, acute hypoxemic respiratory failure, acute on chronic hypercapnic respiratory failure, or chronic hypercapnic respiratory failure. Habitually including all three parts prevents incomplete documentation. Be aware of common documentation misses. Terms like, quote, respiratory distress or respiratory dysfunction are not ICD-10 acceptable and will not code. Additionally, never use the abbreviation ARF. It is ambiguous, as it could mean acute respiratory failure or acute renal failure. Always spell it out. Another subtle but important issue is the phrase, in the setting of. This is ambiguous because it could imply a cause and effect relationship, or simply that two conditions coexist. To ensure accurate coding, always clarify the relationship between the diagnoses in your notes, an addendum, or by responding to a CDI query. Finally, recognize other severe conditions. Respiratory arrest is the absence of spontaneous breathing requiring assistance. Document the supporting clinical findings. ARDS or ALI are life-threatening conditions involving systemic insults, typically presenting with specific P to F ratios and chest X-ray findings, often requiring intensive care. To summarize, remember these four habits. Build all three parts of the diagnosis, use only codable terms, never abbreviate ARF, and clarify relationships like, quote, in the setting of. Adopting these habits will ensure your documentation is always complete, specific, and ready for coding.